Good evening. Welcome to Health Quest. I'm Kelly Prince, and it's my pleasure to welcome all of you here. As with COVID-19 in general, many of us now have a lot of questions about the booster shots, which were recently approved by the FDA. And many of you who join us every month may remember our speaker tonight, Dr. Praveen Buddiga, who was here in March when we were first talking about COVID-19 vaccines. He has graciously agreed to share his time with us again tonight to talk about the boosters that are now available. By way of introduction, Dr. Buddiga places family first. He opened his clinic, Buddiga Family Allergy, Skin, and Immunology, after recognizing a general gap in care and compassionate understanding for people suffering from allergies, asthma, immune, and skin health conditions. This led him to impart unprecedented levels of diagnostic evaluation and early intervention treatments to help every child or adult he meets live a healthier and fulfilling life. Beyond his dedication to private practice, Dr. Buddiga is also an assistant clinical professor at the University of California, San Francisco, and UCSF Fresno. He has trained and clinically rotated at some of the world's best programs in allergy and immunology, as well as medicine, under leading doctors who are at the forefront of these specialties. He is board certified by the American Board of Allergy and Immunology, a conjoint board of the American Board of Internal Medicine and the American Board of Pediatrics. He is also board certified by the American Board of Internal Medicine. All these fall under the oversight of the American Board of Medical Specialties. He actively pursues the latest evidence-based technologies and treatment solutions to ensure he can continue to bring forth the best care that is current and up to date. He was recently named by Authority magazines as a hero of the COVID crisis. Again, we welcome Dr. Buddiga. Thank you for being here with us tonight.
Thank you for having me. So, thank you for your time today listening to my little talk about COVID boosters and how we have actually gone through the 2 years. It's really passed by fast, and we are at the booster stage right now. And I'm going to go ahead and do that presentation for you guys. And if you have any questions at the end, please feel free to ask. Very important, my disclosures, I have no conflicts of interest. So really looking at the slide here, you can see COVID in red, and it's actually aggressively SARS-CoV-2 invading normal tissue. And this is actually a it's a micrograph from the lung tissue. The white stuff represents the lung tissue, and of course the red represents the invading I want to show you guys, right, the pointer. This is the invading virus, or the coronavirus right here, invading normal lung tissue. My goal today is basically to somehow advocate for the eradication of COVID in this world. And how do we achieve this? And it's simple, by vaccination, by prevention of spread. And what happened is we, early in 2020, in March, we started working, we meaning the United States scientific community, started working on trying to develop vaccines, top-of-the-line vaccines, with a new type of technology known as the mRNA platform technology, from which they derived a very good working vaccination. And not only one company, but multiple companies, and such as Pfizer, Moderna, in association with the NIH and with Dr. Fauci's team over in Maryland. And also Johnson & Johnson also came out with the adenovirus-based vaccine. And all three were very effective. And we went through some growing pains in the initial getting used to actually the different formats, because Pfizer and Moderna were both 2 series, 2 shots given 3 to 4 weeks apart, versus the Johnson & Johnson, which was a 1-shot and 1-shot vaccination. And then soon after we tested it on millions of people, we noticed that the Johnson & Johnson did have the FDA put a hold on it temporarily when there were adverse effects known as blood clots. And later looking at the data all over again, the FDA approved it for resumption. So it resumed Johnson & Johnson in light of those adverse events. What is the success methodology? Vaccination is to control a pandemic, from an endemic to pandemic. There's only the success methodology is number 1, vaccination, limitation of close activities. That's why a lot of sporting events, we all have faced this and we all went through it together. And closing activities, masking was almost made mandatory in certain areas, and testing was very, very important. Treatment with I've lost some very close colleagues to this disease, and unfortunately I had lost them before the vaccination came about. So that's why I'm a very, very strong advocate of the vaccination. Treatment with antibodies such as remdesivir, and also currently with just almost a few days ago, treatment with a new tablet by Merck Pharma was actually authorized to control infection, and the data was submitted to the FDA. And this is going to be a full game changer. That we have a tablet too that can control infection. But we always remember that the number 1 defense mechanism that we can create is the vaccination. And that's why everybody should get vaccinated, those who are eligible to, at least. How do we reach herd immunity? It's a sad fact that more people died this year than died last year, especially after the New York crisis in 2020. The numbers kept going up and up, and we had a little lull coming down, but then we had a resumption of, almost like the 3rd wave right now. We're getting over the 3rd wave, known as the Delta wave, with COVID, and hopefully everybody gets vaccinated who are eligible, and we can put an end to that and have no more other waves. I think 3 is not asked for, but unfortunately it is what we have to walk through. Currently, the recommendation is still to vaccinate. As we know, 80 million Americans who are eligible are still not vaccinated. I repeat, are still not vaccinated, despite the abundance of availability of 3 types of vaccine: Pfizer, the Moderna, the Johnson & Johnson. And I plead to all to please, those who are eligible, to please get the vaccination, especially on an important day like today, when the first thing in the morning this morning, I was very happy to know that the data, Pfizer had submitted the data today for those who are 5 years to 11 years to the FDA for approval, and we probably expected by the end of the month, Halloween or the first week of November, hopefully to get the FDA approval in that age group. And that way, any human 5 years and above is going to be covered by vaccination. So that's the holy grail, and that's what I look forward to. Moving on, this is a slide from last year, and it shows the heat map of the different parts in the United States. The darker meaning more cases, but this point is mute at this point because this picture is not is almost mute because everything became the heat map, the whole country as well as the whole world. This is from last year, but now everything became red all over the world because this, as we all know, this disease spread everywhere to every corner of the world. Well, it is very hard making a vaccine. It takes almost decades to create a vaccine, and we should, as Americans, we should pat ourselves on the back for the research our scientists have done by creating a workable vaccine in almost a matter of weeks. So I think that is a big, almost a Nobel Prize winning kind of science move that were able to create a working vaccine, not one, but three, in a matter of just a few months with the studies, which normally takes decades. For instance, for HIV, we don't have a vaccine. So that way, and we actually have saved millions and millions and millions of lives from all over the world by bringing this vaccination to bat. Well, you can see here, this is kind of like a graph. There's a cartoon right here, which shows the placebo of the incidence after the vaccine. And this is when you get, placebo effect. And this one shows the days after the dose of the Pfizer vaccine. That is the antibody protection. So, what is the solution? Well, close the gap. We need to close the gap by vaccinating, giving boosters to those who are eligible. Who is our target audience? Well, all generations. They say Generation X, Generation Z, Generation, you can put any number or plate or anything, but I think the most important is all generations are eligible for this vaccine. The 5 to 11 year is seeking FDA approval today, submitted this morning to Pfizer by the FDA, and we should have that results in a few weeks. But anybody 12 years and above are currently eligible to get the vaccine. And those right now, for the boosters, when it comes to the boosters, only the high-risk people, especially those 65 and above, and those in residential homes, as well as anyone, I believe, I'm going to read the CDC criteria because this is rapidly expanding. And the CDC recently came out and said that anybody in a high-risk field, such as the medical field, first responders, caretakers, all are eligible to get the boosters. So those who have received the Pfizer vaccine in the series are eligible right now to get a booster for Pfizer per the CDC. So number 3 is it's easy to end this. We have the tools in our hands. We have a vaccination and we have the boosters. What is the booster technology? It's the same thing as the mRNA platform. Pfizer, currently, it's being given as an active booster to all those 65 and above and high-risk people in exposure situations per the CDC guidelines. Moderna is pending FDA approval, and research had shown and the trials have shown that the best dose is 1/3 of the previous series. The actual dose of Moderna was 150 micrograms, but I believe the studies were done with 50 micrograms, 1/3 the actual dose, and that data was submitted to the FDA for approval. So we should hear from that shortly regarding the Moderna too. So those who receive the Moderna vaccines will be eligible to get their booster very shortly once it passes the regulatory scrutiny. This is a 2-year action plan that everybody can kind of have a little deja vu here and go back in their lives and understand where they were when they were first informed of this unfortunate pandemic, as well as the first cases of the SARS-2 COVID in the United States was first reported in probably the second or third week of January. And onwards, there was also a control in terms of who was coming into the United States by that current administration. There was a little blockade for a few days until we understood, and there was a total blockade then onwards, especially at the airports, in terms of entry from those regional countries. And as you can see in the graph on the lower side, let me bring the pointer out. So this is where I was talking about the first cases. As we see, in February, March is when everything started to brew, and by March, we really had the incidence increase. So therefore, March onwards, we understand that most of the schools, as well as other institutions of business, also were actually closed due to COVID. Immediately, the launch design of the vaccine was started. Trials were started, and by July and August, in that time frame, most of the trials had ended, and we were very lucky to have good results, almost about 80 to 90% effectiveness of the vaccine, both Moderna as well as Pfizer in this time range. So therefore, it was submitted to the FDA again right here. Excuse me, right here, and then it was approved on December the 8th of 2020. Which is a little typo here, but it's 2020, December 8th, 2020, and the vaccine was accepted. So December 8th onwards, we had two working vaccines. We had one working vaccine, excuse me, the Pfizer, and a week later, Moderna, I believe on the 18th, got approval. So both were approved in December of last year. Coming to this year, dose 2 series, so it was given, so the first doses were administered in December of 2020. The second dose was administered 3 to 4 weeks apart, which would be 2021, early this year. And here we are, and today we are almost right. Today we are here, right here. So, and last month, just a few weeks ago, SARS-CoV-19 boosters were FDA approved that were made by Pfizer after the trials. Moderna, we should get Moderna results very soon right here, and we have already resumed boosters. So we are in a very lucky situation now. Well, what was the cause of this third wave? Well, we knew last year when we discussed it from the same position here that there was multiple mutations because of the spread of this virus. And unfortunately, there was a Lambda, and then there was Delta, and now Delta was very, very aggressive throughout the world. And I lost a lot of family in India due to the Delta virus, and it was very, very, moving and emotional time for me earlier this year when, every day I would get a call saying his cousins of mine had died, and unfortunately they were in the same age group as me, plus minus a few years. So, and lo and behold, within a few months, this has transmitted to the United States, the Delta virus, and it also made a huge impact here in terms of death rate, unfortunately. Again, going back, trying to understand the concept of herd immunity is extremely important. That's why I'm going to repeat myself from the slide I previously had shown you last year, earlier in my prior presentation. The reason why it's so important that we have a low R number is R number represents how much one person can transmit the infection. So in this case, it's R is equal to 1. So he sends it to that person, spreads it to one person, that person, another person spreads it to another person. So whereas R number 4, he can spread it to 4 people at the same time. and that 4 people can represent 4 people. So it goes exponentially, logarithmically, and it just cannot stop once that train starts. The only way we can nix it and stop this is by vaccination. And so the lower the R number, I believe SARS-CoV-2 had COVID-19 had an R number of 3.2, I believe, which is also 2.8 to 3.2, and I believe the highest was smallpox was the highest R number. Who's eligible to get the CDC booster per the CDC? COVID-19 vaccine boosters, they're available, made by Pfizer right now. We're awaiting approval on Moderna's, but the trials were very successful, and currently 65 and older, anyone 18 and above, living in long-term care settings, anyone with underlying medical conditions, and anyone in high-risk settings who live and work in them. And so anybody 18 and above who are in a high-risk area in terms of occupation, exposure, they could be paramedics, they could be police officers, first responders, firemen, and also long-term care residents. Everyone is eligible to receive the Pfizer vaccine. That would be because the studies have shown that in approximately 7 to 8 months of receiving the second vaccine, the antibodies levels slowly tend to wane down. That is why we are here today in the situation where a booster is required to be given, at least in a time frame of 7 to 8 months after your second Pfizer vaccine. And that will hold true also with the Moderna, I believe. So in summary, this pandemic can be stomped out if all of those who are eligible get vaccinated. And another important point is masking. Masking also prevents rapid spread and slows down the spread. So these are some of the steps that we can take and may result in a happy and safe 2022. And we are looking at probably mid-2022 when everything becomes safe if we take action today. And I plead to everyone to be safe. There's a little slide just to break the monotony from Oronzo, Italy. These are places we can go, but the pandemic has to end. And I want to thank you for your attention, and I'm open for questions, Q&A, and I want to also give special thanks to the County of Fresno, Department of Public Health, Dr. Wara and team, Derek and everybody else who supported us in distribution of the vaccine. I personally vaccinated hundreds and hundreds of people here in Fresno, and I was very happy to be able to be put in that position with their support. You can also follow me in LinkedIn and at Dr. Praveen Buddiga on Instagram. And again, thank you, and I'm open to Q&A.
And this is Kelly. I just realized that I forgot to mention there is a handout tonight. So if you're interested in having a copy for yourself, just check that out in the GoToWebinar toolbar under handouts. And likewise, if you have a question for Dr. Buddiga, go ahead and type it into the question box, and I'll be reading those for him. So first question is, what is your opinion about the pill from Merck instead of a booster? You touched on that a little bit. I'm a strong advocate of the vaccination, and the pill or the tablet from Merck is only if you have already actually acquired the infection. So it's too late at that time. I mean, it does help. Definitely, the tablet helps to reduce the extent of the infection in terms of preventing possible hospitalization and possible death. But, it's very difficult to say this is brand new. And the first thing is you don't want to be put in a position where you have to get the medicine or the tablet. You want to be
protected with your own innate antibody protection by the immunization. That is the first line sort of defense from the immunology standpoint. So I would highly advocate for the vaccination.
This is a question that I had, so I'm glad that somebody asked this question. Can you get the flu shot and the booster shot together or at the same time?
That's a very good question, and I get this question very often. Being an allergy specialist and immunology specialist, I give a lot of allergy shots, and patients ask, "Can I get the flu shot, allergy shot, and the COVID shot on the same, at least within the same time frame?" And this is my rule of thumb: is you can get the flu shot, but I would keep at least 2 weeks before you go ahead and receive a COVID booster shot or a COVID shot. And the reason for this is you don't want to confuse your immune system into thinking on working. You're taxing your immune system by presenting it many variants. So I would let your immune system concentrate on one variant at a time. So you give the flu shot, wait for a week or so, then you can go and get your COVID shot. To be more safer, I would wait for 2 weeks. When you're coming in for your allergy shot, I'd probably wait for a week. So that's the answer there.
Can you take a different brand of the booster than your original vaccine?
The short answer is it's not recommended. The CDC hasn't given any formal recommendation on that. I would not recommend it too. If you receive Pfizer 1, Pfizer 2, you've developed very strong antibody protection in the Pfizer regimen. So I would receive only the Pfizer booster number 3, and that will maintain continuity in that antibody protection. If you receive Moderna 1 and 2, I would await for the FDA approval, which is coming shortly for the Moderna 3. So please try to stay with the same format. There's been no formal studies done where people would mix and match in terms of having Pfizer plus Moderna, Pfizer plus Johnson & Johnson. So there are various combinations, but no studies have been done in humans.
Along that same line, do you know when the Johnson & Johnson booster will be available?
To be honest with you, I don't know when the Johnson & Johnson is going to be available, but I do know that the Moderna should be FDA approved hopefully FDA approved in the next few weeks, because they've submitted the data. Johnson & Johnson hasn't submitted the data yet, so once the data is submitted, probably in a few weeks after that, so roughly a few months, I would say, Johnson & Johnson, but I don't know the exact date.
Can you please go back to your earlier slide that showed a graph depicting the day after the vaccine and explain it a little bit more?
So this is the COVID cases and the placebo. This is the incidence of the COVID-19 after the first dose of the vaccine. And as you can see, this is results by days after the first vaccine dose. COVID-19 cases in the placebo group, where there were 21,686. And this is COVID cases in the Pfizer group. So we're comparing the placebo group with the Pfizer group. And as you can see, the numbers were exactly almost the same, 21,000 versus 21,000. So we're comparing placebo, where the patient thought that they were getting the Pfizer vaccine, but didn't get the Pfizer vaccine. And we're comparing it with the real patients who got the Pfizer vaccine, and they look at the before and after the first and second dose, and they compare the antibody protection as well as the cases, and who go ahead and have who move ahead and have disease. And that's what the symbols represent, is those who went ahead disease and those who received Pfizer vaccine, which was down here, and do not have disease.
Yeah.
Placebo, they move forward with actually succumbing to the disease.
Next question is, why is the proposed dosage of the Moderna booster lower than the previous doses, but Pfizer is not lowering their dose for their booster?
Well, the studies, this is basically, that's also a very excellent question. The reason for that would be that in the studies, it's been shown that when they, after month 8, the Pfizer vaccine antibodies started to wane, meaning fall down. Whereas with Moderna, the antibodies also started to wane, but the amount of antibody and the amount of vaccine needed to generate the same amount of antibody, safe antibody level was much less. So therefore, the dosage, the best, you always want to give the smallest dosage to get the best effect and a longer effect. And safety is a big issue because there were some reported side effects of the Moderna vaccine in terms of myocarditis in children, inflammation of the heart muscle. So that's why you want to give the smallest dose and get the best effect antibody level wise. And that's why the lower dose. The studies have shown that you get a better response that way.
I'm looking forward to getting my booster. Do you have any idea when we will need another booster?
Very good question. Again, probably I would say if everybody gets a vaccination, or 85% of Americans do get the vaccination, we won't need a fourth series. We won't be needing. My hope is we won't be needing that fourth booster. But right now, as it stands, as long as a significant subsection of Americans in this country and the world actually is not vaccinated, we're still open to if we are naive, immune naive, then we will be susceptible to this virus, whether it be Delta, whether it mutates to Lambda, whether it mutates to some other Greek figure, in the language. So the only thing we can do to prevent ourselves from for even being exposed or coming down with this illness is a vaccination.
What is your recommendation if your first shot was the Johnson & Johnson?
If your first shot was Johnson & Johnson, I would await for the Johnson & Johnson approval to receive its FDA clearance and then get the Johnson & Johnson. Hopefully, we're still awaiting the trials on that, so I can't speak until I see some of the data on the Johnson & Johnson clinical trials. The Moderna and the Pfizer are a little more clearer to speak for because the data is out.
I received my second dose Pfizer in January of 2021, had COVID in August of 2021. Do you think I should get a booster or should I wait?
Can you repeat when she got the second?
Sure. Second dose of Pfizer in January of this year, 2021, and then had COVID in August
of 2020. She had COVID in August of 2021. So she is 2 months out. So I usually wait for 90 days since you had COVID to get the vaccination. So you should get the vaccination probably towards the end of this month. 90 days since you had the COVID illness is when you should get the vaccination, so plus 90 days. So she'd be eligible probably in October, depending on when, towards the end of October.
So this is interesting. In the case of the question we were talking about getting the flu shot and the COVID shot at the same time, in that situation, which do you recommend getting first, the flu shot or the booster?
That's straightforward. Thank you. That's an easy one. The COVID shot. we get the flu shot every year. Our bodies see the flu shot every year. We need to get this pandemic under better control. So I would, first dibs goes to the COVID shot.
I had a very mild reaction when I was vaccinated in January. Should I expect a more moderate or severe reaction to the booster?
Excellent question. You should expect a moderate. I don't expect a severe reaction to the booster, but I expect a moderate reaction, or maybe the same reaction. Just to be on the safe side, I would always take something like an antihistamine, as well as something very simple like Benadryl or Tylenol post-vaccination. And at the vaccination site, I would always put some ice on it just to kind of calm it down a bit. So those are some of the, to prevent any kind of adverse site reaction, as well as internally systemic reactions. The Tylenol will help with that.
Is there a reliable or recommended test to check antibody levels after a COVID vaccine or booster?
Yes, there is. Quest Diagnostics does perform quantitative, it's called a quantitative antibody level for the spike protein antibody level. So yes, there is a Quest diagnostic test for that.
I work in a non-clinical setting and I'm under 65. Should I take advantage of getting the booster, or is it safe to not get the booster?
If it's non-clinical setting and there's no, this is when the previous question comes into play of getting a quantitative test. You should get a quantitative test to see what your antibody titer is. If it's below 5, then I would definitely get the COVID booster. If it is in the range of 15 to 20, you're pretty safe and you're pretty protected. And this is a quantitative test through Quest Diagnostics that you can basically get your level of antibody protection, providing you've got Pfizer 1 and Pfizer 2 vaccines. The same thing with Moderna 1 and Moderna 2, as well as Johnson & Johnson.
Okay, we're going to take one more question because we're over on time here. Last question, the effectiveness of the first 2 vaccines is presumably 7 to 8 months. How is the effectiveness of the booster?
Excellent question. It's going to probably give us another 7 to 8 months. In all honesty, I think it's going to give us another 7 to 8 months. That's why it's very important that everybody gets vaccinated, series 1 and 2 of the Pfizer vaccine, and gets the booster of those who are eligible. As you know, this morning the FDA has received the data for the 5 to 11 age group, and once they get their approval, we should be on our way home in terms of getting the whole population vaccinated, and hopefully have a safe and a good 2022 and try to resort to come back to as normal as we can possibly be with the whole family vaccinated. Thank you again.
Getting several comments here thanking you, Dr. Buddiga, and I agree. Thank you for being with us tonight. So many people are saying thank you. They appreciate you taking time and that it was great information. So I agree with that, and thanks again to all of you for joining us.
Thank you.
A quick note that our next webinar will be on Thursday, November 4th at 6 p.m. with cardiothoracic surgeon Dr. Heidi Reich, who will give a talk about treatment of heart valve problems in the COVID-19 era. So thanks again, everyone. Thanks for being here. Good night.